The outbreak of coronavirus, otherwise referred to as COVID-19, has thrown the world into fear and panic, even as all hands are on deck to fight the deadly virus. The Catholic Caritas Foundation of Nigeria says the federal government was not proactive enough with its precautionary measures in curtailing the spread of the virus, as there were no adequate facilities in place. Clearview TV's Anita Patrick has more.
Following the confirmation of new cases of coronavirus infection by the Nigerian Center for Disease Control (NCDC), more concerns have been raised on the precautionary measures put in place, though governments at federal and state level have come up with a number of measures, including directives on lockdowns and bans on interstate travels. The Executive Secretary, Catholic Caritas Foundation of Nigeria, Uchechukwu Obodechina, says Nigerian leaders must stamp on their feet on the ground to ensure total compliance by all citizens. He also calls for a proper health system to be put in place to deal with cases of outbreaks of epidemics in the country.
The government has to create more awareness about the need of these precautions. She must also begin to look for assistance from other nations. If she has gone 2 steps, she must go 4 steps. Because it's not a problem Nigeria can solve on her own. America is not able to solve it on her own alone. Neither is Italy, neither is Germany. There must be a bilateral collaboration among these nations to come to the aid of Nigeria. 2, private citizens of this country who are well-to-do philanthropists are also called upon at this critical time to do supplies of test kits as much as is able and possible, so as to arrest this virus before it spreads dangerously and consumes Nigerians like wildfire. 3, the government must also come up straight in her policies and her principles about this reality, facing the truth as it is, giving the statistics as it is, and then bracing up with the challenges, making more funds available to private institutions, private agencies and hospitals to make equipment available so that life could be rescued. It is not a palatable time for any government. It's a very difficult crisis moment. And any government that is not so much prepared to respond in such critical situations will also question and examine its reason of being.
Obodechina, however, expressed the readiness of the Catholic Caritas Foundation of Nigeria to collaborate with the authorities to create more awareness in churches and other platforms to guide citizens on proper hygiene to fight the killer virus.
The bitter truth has got to be said that our government was not sufficiently proactive. We had expected the government, when we discovered the first case of coronavirus in Nigeria, to have been much more drastic in her approach to issues. But like things Nigeria, they didn't take it seriously. Now, even till this moment, we are still not very certain about the direction of the government, because the citizens expected a drastic shutdown effect so as to curtail the widespread of the disease, especially when we already know that 90% of the infections are not from those who have been in Nigeria. It has been with those who came from outside into the country. And therefore, if there were, first of all, the political will to say there should be no coming in of flights, automatically they will reduce that transmission. Or that there should be no interstate movements, to avoid the spread. Because we have seen how the bigger nations are under turmoil as a result of this virus, in spite of the scientific sophistications. And in our own case, we have nothing in the hand. The health sector is had nothing. The testing centers, how many are there? Over 200 million Nigerians. How many test centers do we have in this country? What are the facilities? We don't have them.
With a lockdown in most cities across the country, the cry of many Nigerians is how they can survive without work or accessing their businesses. Annie T. Patrick, reporting for Clearview Television.